interesting case for me, because it got me really learning a lot about what this really is. Now, this is actually a version of conversion disorder. So conversion disorder is when we have kind of a mental stimuli that then is manifested into something physiologic in nature. What do you know about conversion disorder?
My understanding is that it's a physical symptom due to a significant stressor. So you can, for example, lose motion of your arm temporarily. And I'm just throwing a wild example out there. That sounds very serious, but it has been known to happen before,
Right.
in response to a stressor such as, I don't know, let's just say you lost a cousin to a sudden motor vehicle accident.
Right.
And just that emotional stress is enough to manifest in a physical sense, and sometimes even in a way as scary as you possibly not being able to move your arm for a little bit.
Right. Even, or like episodes of like mutism, which is maybe like a version of catatonia, but is it catatonia or is it a conversion disorder? I've seen actually that exact case after it was a recent grief where one of their loved ones passed away and they just like stopped talking for like 3 months.
Right.
Kind of like,
so a lot of things can happen.
Yeah. So this psychogenic non-epileptic seizures, they think, is a version of conversion disorder. It's actually fairly common. They estimate that between 2 to 33 people per 100,000 people have psychogenic non-epileptic seizures. It is actually more women than men.
Okay.
At the end of the day, more women than men. And they mostly actually see it in younger individuals below the age of 35. And it's actually also more prevalent in people with intellectual disabilities. They theorize that maybe that person can't put their feelings into actual words. And so then they act them out in
That's
in
very
motions.
interesting. It's very interesting. So just to kind of summarize what you said, psychogenic non-epileptic seizure is something that is induced by an external stressor.
That it's unfair to really say that. We don't exactly know what's causing it. A lot of these individuals, though, at the end of the day, and I don't have the exact numbers in front of me because measuring this is very, very challenging. And it's not like there are also seizures and non-epileptic seizures are mutually exclusive. Sometimes people do have a history of epilepsy, but then they'll have these movement episodes that are non-epileptic in nature too. Okay, and also, how do you perfectly measure people who have history of trauma or people who have history of anxiety? We try to measure these things for a living, but we know that the sensitivities of our tests, and when we ask patients, hey, do you have any trauma history? Like, of course, we're not always going to pick that up 100% of the times. But a lot of times, these individuals do have a history of mood disorders, post-traumatic stress disorders, anxiety, sexual, physical, emotional abuse, maybe personality disorders. It's very, very common. So the best way to treat it is perhaps maybe the underlying cause, offering some therapy for those various mental health conditions. There have been some research showing that cognitive behavioral therapy can help. It's not perfect, though. Perhaps some of the medications that we use for post-traumatic stress disorder, like SSRIs, SNRIs, kind of the classic treatment that we see, can help, but it's not perfect. What would you want to learn more about psychogenic non-epileptic seizures?
I guess the biggest question would be what we can do for patients that's given this kind of diagnoses, because the cases I've been involved in have always ended in the psychiatry service kind of commenting outpatient follow-up for therapy. There's nothing that we can do besides treat their external stressors, to treat underlying anxiety, depression, whatever else it may be. So my understanding and my frustration is that it seems like there's nothing that we can do targeted at minimizing future episodes of these seizure-like episodes. Is there anything that you're privy to in terms of what we can actually do for the patients?
Well, I think one of the most important things is convincing the patient, the family, and even the other medical providers that this is a legitimate condition, that this person is not faking it. They're not just doing this to get attention. They're truly suffering, and they're not, who would really choose to necessarily be this person that's thrashing out in nature? We have to view that patient as someone who's suffering.